So today I'm presenting my final case study on CVS Health. My recommendation is CVS Care Navigator, which is an AI-supported and human-backed care navigation model. The point is not just to add another app. The point is to make CVS's existing pieces work together better. Pharmacy, Aetna, Caremark, retail locations, care delivery, and digital support. My argument is that CVS already has the assets, but the strategic opportunity is making the experience simpler and more trustworthy for every customer. So here's the roadmap for this final case study. This section shifts into strategic synthesis and company profile. The goal is to keep the presentation clear so it's easy to see and easy to follow. CVS is not just a pharmacy chain anymore. That has been the main theme throughout the entire course. CVS now touches pharmacy, prescription, drug coverage, health insurance, care delivery, and digital tools. That gives the company a real opportunity, but also a real execution problem. The customer should feel like CVS is making healthcare simpler. If the business still feels separate to the customer, then the integrated model isn't reaching its full value. The external environment is the reason the Care Navigator idea makes the most sense. The first force is affordability. Healthcare costs are high and confusing, and that creates demand for better navigation. The second force is PBM and drug cost pressure, which matters because CVS Caremark is part of the CVS model. Third is digital disruption and AI are changing what customers expect, but healthcare AI has to be careful because privacy, bias, security, and patient autonomy are very important concerns. The fourth force is trust. CVS has to show that the integrated model creates value for people, not just for the company. The external analysis showed that CVS faces cost, regulatory, digital, and trust pressure. The strategic analysis showed that CVS's main advantage is differentiation through integration. The corporate strategy analysis showed the logic of vertical integration and related diversification. The culture and structure analysis showed the problem. CVS can own the right pieces, but if they operate separately, the customer still feels the fragmentation. So this is why my final recommendation focuses on execution and integration and not just adding some new technology. So this is the current CVS business model canvas. The customer segments include patients, Aetna members, employers, government payers, providers, and pharmacy clients. The value proposition is convenient health access through pharmacy, benefits, insurance, and care services. CVS reaches customers through stores, apps, websites, mail pharmacy, employer channels, and care teams. On the operational side, the key resource are the pharmacy footprint, Aetna, Caremark, data, clinicians, pharmacists, brand, and digital platforms. The key activities are dispensing prescriptions, managing pharmacy benefits, administering health plans, coordinating care, and digital engagement. The revenue streams come from prescriptions, premiums, PBM services, specialty and mail pharmacy, retail, and care services. The cost structure is heavy because CVS has drug costs, medical claims, workforce costs, technology, compliance, retail stores, and care delivery. So this next section shifts into strategic recommendations and business model innovation. These are my 5 recommendations. The main recommendation is CVS Care Navigator, but that recommendation can't stand alone. It needs affordability support, cross-business teams, responsible AI governance, and a pilot model. I do not think CVS just needs to keep getting bigger and bigger. At some point, it has to scale. The question is whether leadership can make the scale work better for the customer. That is why each recommendation is connected to implementation, not just strategy. So this is the revised business model canvas. The customer segments are Aetna members, chronic care patients, employer clients, and pharmacy customers. The value proposition is one clearer way to understand benefits, medication options, costs, and next steps. The channels are CVS and Aetna digital tools, pharmacy visits, text or email, and employer plan touchpoints. The key resources are exactly what CVS already has: Aetna, Caremark, Pharmacy Access, clinicians, data, and brand. The innovation is not random. It builds directly on the current CVS model and tries to make that model easier to use. So these are some objectives that can keep that strategy grounded. CVS should improve navigation and trust, strengthen differentiation, protect margins through better coordination, build responsible AI capability, and stay resilient through pilot programs. So I'm not recommending a huge overnight transformation. The smarter move is to pilot the model, measure it, and then scale it if it does work in those pilot programs. So now this section shifts into a financial analysis. The financial picture is mixed. CVS has enormous scale with about $402 billion in 2025 revenue, but those earnings were pressured by impairment and litigation charges. That matters because the transformation cannot be treated like a blank check. The case for Care Navigator is that it uses assets CVS already owns and focuses on coordination, trust, and efficiency. It should be financially disciplined, not a huge, expensive side project. For competitors, I use Walgreens, Amazon Pharmacy, Mercy Health, and then a small mom and pop pharmacy category as well. Walgreens is the closest public retail pharmacy comparison. Amazon Pharmacy is the digital disruption comparison, but Amazon does not report pharmacies separately, so the financials are company level. Mercy Health is a care delivery comparison, and the mom and pop pharmacies represent local trust. CVS's answer should not be to copy any one competitor. Its strongest move is connecting pharmacy benefits and care in a way that other models cannot easily replicate. The pro forma is not management guidance. It is a case study model based on stated assumptions. The model assumes CVS revenue grows from about $402 billion in 2025 to about $502 billion by 2030. It rises as the model scales and operating margin improves. It also rises in the base scenario. The logic is that Care Navigator is not a separate, unrelated business. It uses CVS's existing ecosystem to improve engagement, coordination, and efficiency. The sensitivity analysis tests the model instead of pretending like, the future is certain. In the best case, the incremental 5-year NPV is about $4.7 billion. In the downside case, it is about $4 billion, and in the upside case, it is about $5.5 billion. The important point is not that these numbers are perfect. The point is that leadership has to track adoption, cost, margin, and trust. If those do not move in the right direction, the model should be revised before it scales. So CVS has scale, but it also has margin pressure and debt, so leadership should not chase innovation without discipline. The Care Navigator makes sense because it is an integration strategy. It uses what CVS already owns. The financial model should be judged through both financial metrics like EBIT, EPS, cash flow, and NPV, and non-financial metrics like customer trust, engagement, and the ease of use. So now we're going to talk about strategic integration and then move towards the conclusion. External pressure is forcing CVS to respond, and the response is the CVS Care Navigator. The capabilities are CVS's existing assets, Aetna, Caremark, CVS Pharmacy, digital tools, clinicians, and care teams. The financial outcome is better engagement and disciplined margin improvement. The trust outcome is a simpler and more transparent healthcare experience. That is the connection between strategy, innovation, and finance. So, AI did help me organize the assignment, think through some of the scenarios, and structure the financial model. But just like throughout the entire course, the AI output still had to be filtered. Some ideas just simply weren't good. Some ideas were too technology based. I had to decide what actually fits CVS, what to pull from my sources, and what made sense both financially and ethically. My biggest takeaway is that AI can support strategic thinking, but it can never replace the judgment required to lead any healthcare transformation. A CVS executive should not treat Care Navigator as just a technology rollout. It has to become an organizational action plan. That means clear ownership across Aetna, Caremark, CVS Pharmacy, digital teams, compliance, and care delivery. The leadership competencies needed are systems thinking, ethical stewardship, data-driven judgment, change management, and innovation management. Leaders also have to balance financial pressure with innovation. That's why I recommend pilots, dashboards, stage gates. The model should keep evolving through feedback from employees, customers, employers, and compliance teams. That is how CVS can turn innovation into execution instead of just another corporate initiative. So in the first 6 months, CVS should design the pilot and define metrics. In months 6 through 18, it should run the pilot and measure the results. From 18 to 36 months, CVS should scale selectively. After that, the model should become part of the operating system, not just a project. The leadership point is to move fast enough to learn, but not so fast that CVS damages trust or overwhelms employees. And these are my references.